This video, you are going to recap on Parkinson disease. We will look at the pathogenesis, clinical features, types, and treatment. Let's look at the pathogenesis of Parkinson disease. In Parkinson disease, there is degeneration of dopamine producing neurons in basal ganglia, including substancia nigra. As you can see in this image, in normal patients, the substancia nigra has its own dark color, but in Parkinson patients, there's neurodegeneration, so the color is reduced. So, because of this, the production of dopamine is impaired in Parkinson patients, and all the clinical symptoms and signs occur due to that. That is the pathogenesis of Parkinson disease. Then let's look at the clinical features of Parkinson disease. This is very important for all of you, how to identify a patient with Parkinson disease. Under that, you should know what are the cardinal features. There are 4 cardinal features of Parkinson disease, starting from tremor. Tremor, there can be pill rolling tremor, where you may see that patient is rolling something in between the fingers, and also it is resting tremor. Like that, the first cardinal feature is tremor. Next, bradykinesia is a cardinal feature of Parkinson disease, which means there's slowness of movement. And the third one is rigidity. Rigidity, there is resistance to passive movements. There are 2 types of rigidity which can occur in Parkinson disease. The first one is cogwheel rigidity, and the next one is lead pipe rigidity. Like that, rigidity is a cardinal feature of Parkinson disease. Next, postural instability is also a cardinal feature of Parkinson disease. However, postural instability occurs later. Therefore, for the diagnosis of Parkinson disease, it is not considered. Like that, you learned about the 4 cardinal clinical features of Parkinson disease. Next, we should know that the clinical features of Parkinson disease begin unilateral initially and later spread to both sides. And there are other motor features as well. So there can be craniofacial features. So what are the craniofacial features? The patient may look like masked facial expression, as shown in this picture. And at the same time, there can be facial muscle weakness as well. So this look is a Parkinsonian face. And also, hypoponia is another craniofacial manifestation of Parkinson disease, where the patient has difficulty in speech. So those are the craniofacial non-motor clinical features. Then visual symptoms can also occur. One of most common thing is hypometric saccades, where the saccadic movements of the ocular muscles in Parkinsonian patients is impaired and it is reduced. And also, vertical gaze palsy can occur in Parkinson patients. And eyelid opening apraxia is another visual symptom of Parkinson disease. Like that, there are craniofacial clinical features and visual features. And also there can be musculoskeletal symptoms and signs. So what are they? Micrographia is a clinical feature of Parkinson's disease where the patient's handwriting is smaller. And also, stoop posture is another musculoskeletal symptom. And then there can be gait abnormalities like shuffling gait, short step gait, and also freezing. This freezing occurs later in the disease. Like that, there can be gait abnormalities like shuffling gait, short step gait, and freezing. Those are the other motor features of Parkinson's disease apart from the cardinal features. And also there are non-motor features. What are the non-motor features? The first one is cognitive impairment and dementia. The patient may have memory disturbances. And next, psychosis and mood disorders like depression. And sleep disorders. The patient may have sleep disturbances. And autonomic dysfunction. So what are the autonomic dysfunctions? The patient may have urinary urgency, urinary frequency, and also patient may have urge incontinence. Erectile dysfunction is also can occur in Parkinson's disease. So those are the autonomic dysfunction. And then the patient may feel pain. Where the patient will feel pain? So the patient will pain in face, abdomen, genitals, and joints. So pain is another possible clinical feature. So like that, there can be non-motor clinical features of Parkinson's disease as well. So we look at the clinical features of Parkinson's disease. There are 4 cardinal features, and we learned that the features begin unilaterally and later spread to both sides. And there are other motor features and also non-motor clinical features. So that is the clinical manifestation of Parkinson's disease. Then let's look at what are the types of Parkinson's disease. Idiopathic is the most common type. So what we refer to as Parkinson's disease is most of the time idiopathic Parkinson's disease. And also vascular Parkinson's disease is another entity where Parkinson's symptoms occur following a stroke. So vascular Parkinson's disease is another type. And drug-induced Parkinsonism can also occur, like after taking neuroleptic drugs such as antipsychotics. So the types of Parkinson's disease you can take as idiopathic, vascular, and drug-induced. Then, how we can treat Parkinson's disease? In the treatment, initial therapy you can do with levodopa. So levodopa is a chemical form of dopamine, a precursor form, and by giving levodopa you expect to replenish the deficient dopamine in the human brain. There are alternative therapies as well. So dopamine agonists, dopamine oxidase B inhibitor, and amantadine. So those are the alternative treatments apart from levodopa. So that is the initial therapy which you can do for Parkinson's disease. Then after that, these patients may progressed to disability, then palliative care approach is important for these patients. Like that, treatment for Parkinson's disease can be done. So in this video, we talked about the pathogenesis of Parkinson's disease, clinical features of Parkinson's disease, the types of Parkinson's disease, and treatment of Parkinson's disease. So you should have an idea about the pathogenesis, that is degeneration of dopamine producing neurons in basal ganglia, including substancia nigra. And there are cardinal features: tremor, bradykinesia, rigidity, and postural instability. The clinical symptoms and signs occurs initially unilaterally and they later spread to both sides. And there are other motor features: the craniofacial, visual, musculoskeletal, and gait. And there are non-motor features like cognitive dysfunction and dementia, psychosis, mood disorders, sleep disorders, autonomic dysfunction, and pain. And there are 3 types of Parkinson's disease. And regarding the treatment, initial therapy can be done with levodopa or other alternative medications, and also palliative care approach is also needed for these patients.